So on this video, we're going to think about how you might feel if you end up having interventions in labour. They can happen for any number of reasons. The baby may be at an odd angle going into the pelvis and might have difficulty negotiating its way around the corner and needing a bit of help to be born. Mum might be very tired if she's had a very long labour and she might not have enough energy left to push her baby out without a bit of help. She may have had drugs either to speed up her labour or to get her labour going, and these may have led to her contractions being stronger than she was anticipating, and so she needed a bit of extra pain relief to help, and that had a knock-on consequence of a baby needing help to be born. Or the baby could have become unhappy for any number of reasons, needing as a result to be born more quickly, and so intervention being needed for that. The thing to remember if you do end up with intervention is that it's not your fault, and quite possibly there is nothing that you could have done differently to have changed what happened at the time, but your feelings around it may be very varied. You might feel very accepting of what's happened. You may be experiencing confusion as to why this is happening. You might be fearful of your baby's well-being and worried that they're going to be okay, and you might be feeling a bit disappointed that things haven't turned out the way that you had anticipated or hoped they would in terms of how your labour went. The key thing to remember is that the doctors will do what they need to do at the time, so they'll really only do intervention if it's necessary, and they'll do the appropriate intervention for whatever the problem is. So you don't really get a choice, for example, between having a forceps or a vacuum cap extraction to help your baby to be born. It will just depend on what the doctors feel is most appropriate at that moment. However, having said you don't have much of a choice, you do possibly have a chance to influence what got you to that point in your labour. So if you remember back to previous videos, you might be able to help your labour with, for example, using your breathing to stay calm and focused and centred and give you some energy. You might use upright positions to help your labour to progress, with gravity helping it and helping your baby into the pelvis and then out of the pelvis in a straightforward way. You might find that asking questions along the way gives you answers that helps you then make further decisions in the future. So whatever happens in your labour, most people find that feeling involved in their decision making and feeling informed about what is happening helps them to have a more positive outlook about whatever does actually happen.